Hello there, and welcome to today's Freshwell Low Carb Nuggets. My name is Dr. Kim Andrews, and I am a GP at Freshwell Health Centre. So today, the aim of this brief video is to try to explain to people how low is low carb and how low should I go, which is a question we frequently get asked. Let's start by getting the boring bit out of the way with a very quick disclaimer. These videos are for information only and should not be construed as medical advice. You should always check with your doctor or nurse before starting any new diet or lifestyle program if you suffer from any health conditions, eating disorders, are pregnant or breastfeeding, or are aged under 18 years old. This is particularly true if you take any medication for type 2 diabetes or high blood pressure, as you may need to reduce your medication. So let's start by asking the question, how low is low carb? And first of all, I really want to say we really don't want people to get too bogged down with carbohydrate counting. That is not the idea of this type of lifestyle approach and is absolutely not necessary. And so many other diets need calorie counting, portion control counting. And really one of the major benefits of a low carb lifestyle is that those aspects really are unnecessary. Basically, we would encourage everybody to concentrate on eating real food, and the rest will naturally follow on from that. And once your new way of eating is ingrained into your lifestyle, you can then start to focus on further carbohydrate reduction. And how low you go really depends on what you're hoping to achieve with your new lifestyle. In terms of carbohydrate levels, there isn't any specific approved definition about what constitutes a low carb diet. In general, the standard British diet consists of around 300 to 400 grams of carbohydrate per day, which we would call high carb. We would suggest liberal low carb is somewhere between 80 to 130 grams of carbohydrate a day. And that is really what we would call, as opposed to that being low carb, we would really call that normal carb. Moderate low carb, we would call 30 to 80 grams of carbohydrate per day. And a very low carb or ketogenic diet, we would specify as being less than 30 grams of carbohydrate per day. So getting started on a low carb lifestyle. Most important thing, number one, cut out sugar. And so obviously that's added sugar to, say, coffee, tea, and also sugar in things like pastries, biscuits, cakes, sweets. Those obvious sugars that we think of. The second step is to start cutting out starchy, refined carbohydrates. And there we're talking about things like pizza, bread, rice, pasta. You need to be very cautious with fruit in general. The tropical fruits like mango and pineapple and grapes and bananas are out, but berries and nectarines and the odd apple and pear is reasonable. And then number four, starting to reduce your starchy veg, your legumes and your pulses. So here we're talking about things like potatoes, we're talking about parsnips, carrots, and various beans. And try to work through each of these levels in turn, starting at the top, simply because there's really no point in starting to cut out the amount of carrots and parsnips that you're eating if you're still consuming bread on a regular basis. So a lot of our patients ask about food lists. They'd like something to help them understand which foods it is that they can eat and which ones that they should avoid. So our low carb program includes red, amber and green food lists for people that would find them useful, and we get some positive feedback with these. And the other useful tip is really when you're reading food labels in the supermarket, if you try to stick to foods with less than 10 grams per carb per 100 grams of product, you won't go far wrong. So in terms of our green foods, this is the beginning of a list of foods that we would encourage people to eat freely to a degree. So lots of above ground veg, plenty of protein as meat, fish, eggs, full fat dairy, and various nuts and seeds. These are amber food lists, and these are probably best to be eaten in moderation a couple of times a week, particularly if you're trying to move into a moderate low carb. And in terms of red foods, these are really ones that you should be avoiding when reducing your carbs when possible. And certainly if you're trying to be moderate to low carb, there isn't going to be a place for these generally in your diet, and certainly none of these on a ketogenic diet. But if you're a liberal low carbing, I mean, it would be up to you how far you wanted to go, but obviously, you know, a banana once a month or something like that is not going to be a massive problem. So in terms of liberal low carb, obviously you need to cut out sugar. You can have occasional starchy carbs once or twice a week, like sweet potato or porridge oats. And you can also have some starchy veg, such as celeriac or carrots, parsnips, etc. And also some fruit, berries, apples, pears, nectarines, peaches. If you're trying to push to the next level, to moderate low carb, then really very occasional carbs like porridge or buckwheat, maybe once or twice a month. And occasional starchy veg with some meals. So the occasional, you know, some carrots or some turnip with some of your meals. But again, you know, maybe once a week, something like that. And there needs to be quite a bit of caution with fruit, and really you're sticking to really berries at this stage and not really any other fruits. And if you want to push to that final step of being very low carb or ketogenic, really there are no starchy carbs that you can eat because they will take you out of ketosis. Starchy veg, again, very rarely and probably not at all. Fruits, the odd berry, but again, you're really going to be having to cut back on fruit to get your body into ketosis, and you would also be having pulses and beans extremely rarely. But your diet would still consist of plenty of high protein meat, fish, eggs, and also lots and lots of non-starchy above ground veg. So a question we get asked quite frequently is, well, what level of carbohydrate should I aim for? And in general, you know, I think this is absolutely open to every individual to set what is right for them. But essentially, the lower your carbohydrate intake, the faster the results that you are going to gain. But you do need to remember this is not a race. You know, this is about making personal changes to your lifestyle for the long term. So make changes that you're going to be able to maintain. And basically, I need to look at any reduction in starchy carbs as being beneficial. Even if you can stop eating your 2 slices of bread for lunch every day, that is better than nothing. So any reduction is going to help you. And there really is no need for counting at all if you stick to these basic rules. Some patients ask us about ketone testing. You know, is it necessary? So ketones are something produced by the liver when it starts to break down your body fat to use as energy. And there is no need to test ketones at all, but some people are spurred on by knowing that they are within what they would call ketosis, or the fat burning zone. And I suppose another important thing just to say is a lot of websites might talk about ketosis and talk about adding certain fats to your diet to try and push you into ketosis more quickly. But generally, we would say if you're going along the line of a ketogenic diet for weight loss, then adding fat doesn't really make any sense. So best not to, in our opinion. So if you decide that you would like to test your ketones, a blood ketone level of around 0.5 to 3 would indicate that you were in a level of ketosis. The most reliable way of testing this is through ketone meters using strips, which can be purchased at a pharmacy or online. However, this is also the most expensive way, but it is the most reliable. Ketone breath analyzers can now be purchased online as well, but again, they aren't very reliable, as what you exhale is determined by many factors, but a lot less invasive than having to prick a finger. And the other way is through urine, using urine sticks, checking for urine. But again, I would say, it's quick and cheap, but really not particularly reliable, because actually if your body is using your fat stores properly and you are in ketosis, you're not actually going to be sending a lot of ketones out into your urine, because you will be burning them for energy. So in conclusion, how low is low carb? Well, essentially, how low you want to go is entirely up to you and depends on the health goals that you've set yourself. But it is important to remember that any level of carbohydrate restriction is going to be beneficial for your health and well-being. Even if you manage to drop your breakfast cereal, or you manage to lose the 2 pieces of bread that you have with lunch, that is going to have a beneficial effect. There is no need at all to push for ketosis unless you want to do this for either rapid weight loss or blood sugar control. And in general, if you concentrate on eating real food and then start to reduce your carbohydrates as you feel comfortable to do so, that's the way forward, and that will reap you the benefits long term. I hope that's been helpful.